All things, okay, things like Zumba and CrossFit, okay, just random stuff. There's no measuring going on. They're not really managing anything. They're just turning up each week doing random stuff. Now there's nothing wrong with Zumba in terms of getting people out of the house, but when they label it Zumba fitness, that kind of gets me going a bit, because there is no real measure there of fitness. And when you look at fitness, it's in a very structured environment, whereby you're looking at progression, and from where I see it, I don't see there's an awful lot of structured progression within Zumba. CrossFit, a great concept, but not many people can even do Olympic lifting. So Olympic lifting with weights, and then they do it to fatigue. Not many people can even do Olympic lifts properly anyway. So then they get them in doing them to fatigue, and all sorts of horror stories come out. You see them on YouTube. Okay, and then then you get the sort of following a magazine program, illustrated by the work which I did with I mentioned earlier with Mike in Los Angeles. Basically proves that the exercises we shot were the best ones for the camera, not the ones that really got the results. Okay, this is what happens in magazines. They don't take pictures of the exercises that are really going to get you the results, or they might, but they're not going to. That's not what they're aiming to do. They just want to make it look good. Remember that things that are sexy sell. Okay, so these things are what they're looking to promote in their magazines. And also, case of a colleague of mine who I've actually studied with, Charlotte Ord, who is a very, very, very good coach. And this week on The Biggest Loser, you'll have seen her coaching, and I know that's not the way that she would really coach a client all the time, and I don't think that was the way she did intend to be portrayed on that program either. So beware of these media programs, because they're only showing you the little bits that they want, or they may even be adapting things to make sure that TV program appeals. Fatigue. Okay, so fatigue. What we got here is a graph of how I do my program design. Okay, in terms of the level of intensity that you will expect during your program. And this is a cycle that we use throughout the year. Okay, so week 1 is this sort of intensity, week 2 goes up, and then week 3 and 4 are your highest intensity sessions, and then week 5 or week 1, these two cross over. Okay, we go back to that level of intensity. So you have sessions within those as well, which we call deload sessions, whereby not every session is a beat up. Okay, so we're not looking to do 100% in each session. Okay, and quite often you'll find that people, when they train, they want to just go to fatigue all the time. Okay, and what we're looking to do is we're definitely looking to take ourselves into that bit there, but we're not looking to beat ourselves up each session. And you'll find that there's not a lot of progression sometimes within a 4 to 6 week cycle in some of the programs that some people are doing by themselves. Soreness. Okay, as I said, training's not a beep every time. This whole thing about seeing the 5 hardest sessions in 5 days, their body must be a wreck. Okay, soreness is great, but you got to know why. Okay, remember all these things, you got to know why. Okay, so common trends in modern training. There's no focus on foundation. Okay, so we're not looking. What you'll see is you're not seeing people getting their cores really strong. They're not becoming tolerant to intensive interval training. Okay, they're just going at it straight off the back. Okay, and there's no real focus on foundation and keeping them looking after their long-term training history. People then you see that just performing the art or the sport as training. Okay, so the typical one is getting fit to run. Don't run to get fit. You will break. So this is what I like to see people doing. Improving their fitness levels so that when they do go running, they're going to run faster, and they'll also be able to run injury-free. Okay, as a result of that. Okay, so do what you're good at / favourite training. Now, there's nothing wrong with these two exercises you're seeing here, like kettlebells and Olympic bar. But what we want to see is these integrated into a more holistic program. And what you'll find is guys will love just doing bench press. Then you get some ladies and some guys as well who just love kettlebells and that's all they do. What we want to try and do is integrate the program so it's holistic. So you're working on different areas of the body. And working on a whole body approach using different training modalities and methodologies to get the results you want. Following Model X or Fighter X's program. So as we mentioned earlier about the program that you'll see in a magazine, it wasn't designed for you. It wasn't designed for me, and it probably wasn't even designed for that model either. But it looks good in the magazine, so they put it in there. Okay, maybe it was their program in certain cases, but I'm pretty sure that they're not going to give you everything that that this person has been doing. Okay, liking to do the fancy stuff. Now this guy here, whether or not he just wanted more likes on Facebook or YouTube or something, but what kind of crazy stuff is this? So 20% of what we do will create 80% of the results that we get. All right, and results are the reason that we should be doing our training. So what I'm trying to say here is that when it boils down to it, what actually gets us the results are 20% of what we really do. Okay, and that 20% is probably the really basic, really well thought out, well progressed training, as opposed to the sort of fancy bits and pieces that you'll see. Guys balancing on Bosu balls and kettlebells hanging out their mouth. Okay, so what I'm trying to say here is, if you're planning your own program, you need to be thinking about trying to keep things simple with sound principles. Okay, so remember, the person who follows principles is always going to do better than the person who chases the faddy methods. All right, so principle-based approach. Only training when you have a big event. Okay, trying to undo 10 years of abuse in 2 months. Okay, you'll see this, like perhaps somebody wants to get ready for a wedding in the summer, and it's now May, and they got this event in July, and they got May and June to get ready, and actually they've been smoking and drinking for the last 10 years, and all of a sudden it's getting a little bit close. It's a little bit daunting that they might end up going to this wedding in this kind of state. So remember that training is forever. Our bodies actually love the resistance that we provide them with. Okay, whether it be body weight or through weights that we use. Okay, now Will Smith here on the bottom right actually said that if you stay ready, you haven't got to get ready, and he's absolutely right. If you're always in good shape, if you're always ready, this is one of the biggest things I like to try and encourage my clients, is that we're not always going flat out at a certain goal, but we're definitely ready in case something comes up that we're looking to attack. Quantity over quality. Okay, ridiculous challenges. I've seen this on social media sites. 100 burpees for 100 days. Don't get me wrong. I love challenges, but you got to remember why you're doing them. Okay, and quite often quality and quantity go in opposite directions. We can, once you're really skilled at the exercise or the challenge that you're looking to do, then perhaps your quality will be really good. But you got to ask yourself the question: is why would you want to do 100 burpees for 100 days and neglect everything else that needs working on? Cardio work. Okay, long, slow cardiovascular training. Okay, it's not efficient, and it's actually stressful on the body. Now, his name's Sean Talbot, wrote a book called The Cortisol Connection Diet. He actually in there stated that exercise that went on for over 30 minutes twice a week, that was steady, so i.e. there was no fluctuation in the levels of intensity and the rest. Okay, so i.e. we just went along the same pace for that amount of time. Actually was more stressful, and that actually led to increased cortisol levels, and actually made us more efficient at storing fat as a result of this kind of training. So it's not efficient in that it takes a long time to get nowhere near the results you can get from the interval-based approach, and also it's more stressful on the body. So you're actually becoming more efficient at storing body fat rather than becoming more efficient at burning it. A lot of people still ask me, what is cardiovascular? Well, it's anything that creates a stimulus to elevate the heart rate. Anything that creates a stimulus to elevate the heart rate. Now, whether or not that's in your training zone is another story, but this is what cardiovascular activity is. So, within the personal training studios and within the fitness camps that we run, I use something that I've created called blast metabolic circuits, okay, or cyclones, as I've now sort of rebranded them within the fitness camp and within the personal training studios. We use pyramids, accumulators, blast wave formula, the burn and fly system to actually get our cardiovascular work done using our own body weight, using our own using weights as well. So the reason we do this, remember why we do this, is because we want to lose body fat, increase muscle mass, and increase cardiovascular capacity. So this is the benefits that you get from doing these kind of circuits that we put together. Very, very small but very intense, that we tend to use them towards the end of sessions as well. Okay, so my core belief around training. Okay, my core beliefs around training. Number one, it's got to be efficient. Number two, it's got to be dynamic. Number three, it's got to be based around movements that we need to do every day, okay? And that's not sitting down. Number four, building, not breaking. Okay, so build the client, don't break them. And number 5 is intensity. Okay, so getting the intensity right, whether or not that be high, low, medium intensity, intensity has got to be there for the most part. Efficiency. Okay, so one of the things you'll see is the Tabata. Okay, most people, if they've done a little bit of training, will have heard this name branded. Okay, let me just give you a little insight into this. The Tabata protocol is 20 seconds on, 10 seconds off, repeated 8 times to exhaustion. It's supposed to use multi-joint exercises. Okay, they actually did it using cycling. Okay, so we got a few joints involved there with the largest muscles in the body. They tested this on Olympic ice skaters who already had very well trained legs. Now they did this with 185% of their maximum effort. Now don't ask me how they found out 185%, but they've got 185% of their theoretical maximum effort. 20 seconds on, 10 seconds off, times 8 to exhaustion. These guys would have just about passed out after doing this. Okay. Now, what you then see now is this 20 seconds on, 10 seconds off being used for things like bicep curls, which for those of you who don't know, you would stand up tall. Okay, you would have your hands by your pockets. You would curl your hands towards your shoulders and then slowly lower them back to start position so the hands finish by the pockets. Okay. Now, I think you can tell the difference already between doing that exercise for 20 seconds and doing at maximal effort on a bike for 20 seconds, okay? Remember that the key here is energy expenditure, okay? So long, slow, boring cardiovascular work doesn't really cause any disruption to the energy systems and doesn't get the response that we need afterwards. So remember, the reason we do these short bursts is to burn calories after we finish. You won't get that with a single joint exercise like a bicep curl done in that way. And think of it like, think about your training around, efficiency around aspirin and sunbeds. Okay, now I'm not condoning either of those at all, but if you think about the way in which they are supposed to be prescribed, you take the stated dose. Okay, they basically give you the minimum effective dose. Okay, so if you go for a sunbed and you're told to go for three minutes, and you go for 30 minutes, chances are you're not going to get a good result because you're going to be burnt. Okay, you have fried yourself, and you spent way too long in there anyway. So you've wasted a lot of money, a lot of time, and you actually still haven't got the result you wanted. And then when it goes for aspirin, okay, you get asked to take 2. So why take 10 if you can get the result you want with 2? And then the side effects of taking 10. Okay, so dynamic is the next one. So think about exercises; they need to be multi-joint for maximum energy expenditure. The more joints you use, okay, the more muscles you use, the more ligaments and tendons are being used. Okay. The more energy gets used, full stop. Okay, need to be movement based. You need to be moving. Okay, like you want to move every day. Generally, it is actually the opposite to the way we live. Okay, because we do live a lot of our lives sat down and lying down, and these have consequences in terms of lower back pain, obviously your cardiovascular health, obesity. So everything needs to be movement based. And also, it's worth noting that running actually releases a hormone that triggers learning. Okay, this is one of the reasons that we don't necessarily always prescribe running as part of a program, but we quite often use exercises that mimic running. Okay, and it actually helps us to trigger learning. If you think about it, when we would have been hunters, we would have had to have learned after running how we either got away from our predator, or we were catching our prey. Okay, so yeah, there's a definite link there. I think, or there's some science and some scientific papers that do show that we actually secrete a hormone that triggers learning after running. So building, not breaking. This one's really about the foundation I mentioned earlier. So I like to think that whenever a client comes in, they're going to be we're looking to build them, not break them. So we're adding supportive nutrition before we take too much out. We are also working on weaknesses before we go to too much dynamic exercise. Okay, so we're working on those so that we don't break our clients.